So I think when an organization is deciding to engage in a value assessment process, there are many factors to consider in that decision and in making the case to your board or your leadership in the organization. I think there are three that we thought of at the FH Foundation, I think that are relevant for other organizations as well. The first is that the value assessment decisions or the results that come out of a value assessment, they will impact the patient population, the people that we serve as an advocacy organization, and also the healthcare providers who serve those patients. So it's important that we engage because the decisions will impact whether the people that we serve get access, meaningful access to additional treatments. We've all worked very hard to make sure that our conditions are understood and that there are available treatments, that there are new treatments in many cases that are approved by the FDA. And then this is another step along the way to make sure that those treatments actually reach the people who need them. And that's one reason why it's important to be engaged, and I think that's a key message for the leadership of any organization. The second reason that I think it's important for organizations like ours, advocacy organizations, to engage in value assessments, and the case that you can make to your leadership is that we all work very hard to make sure that our conditions, in our case familial hypercholesterolemia, is well understood in the medical community and among policymakers, and certainly among the people who have the condition, among the patients who have the condition. That the diagnostic criteria is understood, that the prevalence is understood. We've worked hard on natural history studies, and so we are in many ways the voice of the community, and it's our responsibility to make sure that an accurate picture of the condition is reflected in the value assessment process. Another reason to be engaged in value assessment process is that this will be covered in the press. There will be, so from a communication standpoint, it's very important to be there, be engaged, be the voice for your community when the results of the value assessment come out and when decisions about whether people get access to treatment or don't are being made. So at the FH Foundation, when a value assessment came up for our familial hypercholesterolemia population, what we did was to consult with the leadership of the organization, but also with our scientific advisory board members to ask them to take a look at what was needed and to offer their expertise. And certainly it was at that point that we had to convey to them why we needed to spend our time and resources on engaging in this value assessment process. So the value assessments are new to lots of organizations, to all of us maybe. It was certainly very new to the FH Foundation when the first opportunity came up for us to get involved in a value assessment process. And so what we did at that time was we tried to understand how will our involvement help the patient population that we serve, the individuals that we serve, and what is the value, so to speak, to that population for the FH Foundation spending the time and resources that we needed to spend. And I think that there were those three reasons that we decided it was important. Was number one, that this was going to impact whether patients got access to the care that they needed. Number two, we wanted to be sure that our condition, familial hypercholesterolemia in this case, was accurately represented, that the assumptions that went into this economic analysis were correct about our condition. And number three was that we knew that this was going to make it into the media, and that our condition would be covered, and that the decision making about our patient population would be covered in the media. And we wanted to make sure that the voice of the patient population, in the form of our organization, the advocacy organization that represents them, was heard in that process. value assessments are really the next step after FDA approval of a treatment for our population, for any population that an advocacy organization represents. So we've all worked so hard to make sure that we've got the research about the natural history of the disorder, that we work with the developers of new treatments, and that we get them through to the FDA, and we end up with safe and effective treatments for our patient population. And that's our goal, certainly, is this better outcomes for the people that we serve, for our population. And so I think it's important for organizations to understand that there's still one more step, and that is to make sure that patients actually get access to those treatments. And value assessments are an important component of that process. And certainly engaging with payers, with insurance companies, with pharmacy benefit managers, and with the manufacturers is also very important. But the value assessment is one important aspect of that process, and it's important that organizations understand and really get themselves educated, turn really to the National Health Council for that education, so they're prepared to engage in a really meaningful way on behalf of the patients that they serve and the healthcare providers who serve them.